Why social distancing is must to beat COVID-19. Even in less challenging times, many of us try to avoid close contact with someone who is sneezing, coughing, or running a fever to avoid getting sick ourselves. Our attention to such issues has now been dramatically heightened by the emergence of the novel coronavirus causing a pandemic of an illness known as COVID-19. So many have wondered if we wouldn't simply protect ourselves by avoiding people with the symptoms of respiratory illness. Unfortunately, the answer is no. A new study shows that simply avoiding the symptomatic people will not go far enough to curb the COVID-19 pandemic. That's because researchers have discovered that many individuals can carry the novel coronavirus without showing any of the typical symptoms of COVID-19, like fever, dry cough, and shortness of breath. But these asymptomatic or only mildly ill individuals can still shed virus and infect others. That is the reason social distancing is extremely important at this point. So this conclusion adds further weight to the recent guidance from the US public health experts. What we need most right now to slow the spread of this new coronavirus is to full implementation of the social distancing is must. What exactly is social distancing mean? Well, for starters, it is recommended that the people stay at home as much as possible, going out only for critical needs like groceries and medicines, or to exercise and enjoy the outdoors in wide open spaces if there is no risk in your area. Other recommendations include avoiding gatherings of more than 10 people, no handshakes, regular hand washing at least 6 times a day, and when encountering someone outside of your immediate household, trying to remain at least 6 feet apart. This is the actual definition of social distancing. These may sound like extreme measures, but the new study by the National Institute of Health funded researchers published in the journal Science documents why social distancing may be our best hope for the slow of spread of this COVID-19. Here are the few highlights of the paper, which looks back to January 2020 and mathematically models the spread of the coronavirus within China. For every confirmed case of COVID-19, there are likely another 5 to 10 people with undetected infections. Although they are thought to be only about half as infectious as individuals with the confirmed COVID-19, individuals with the undetected infections were so prevalent in China that they apparently were the infectious source for another 86% of the confirmed cases. So after China established travel restrictions and social distancing, the spread of COVID-19 slowed considerably, especially in the Wuhan city. The findings come from a small international research team that included NIH grantee Jeffrey Shaman, Columbia University Mellon School of Public Health, and this team developed a computer model that enabled researchers to stimulate the time and place of infections in a grid of 375 Chinese cities. The researchers did so by combining existing data on the spread of COVID-19 in China with mobility information collected by a local-based service during the country's popular 40-day Spring Festival when travel is widespread. As these are new findings clearly demonstrate that each of us must take social distancing seriously in our daily lives. Social distancing helped blunt the pandemic in China, and it will work in other nations too, including the United States and all other developing countries. While many Americans will likely spend weeks working and studying from home and practicing other social distancing measures, the stakes remain high. If this pandemic is not contained, this novel coronavirus could well circulate around the globe for years to come at great peril to us and our loved ones. As we commit ourselves to spending more time at home, progress continues to be made by using the power of biomedical research to combat this novel coronavirus. And a notable step this week was the launch of an early-stage human clinical trial, that is investigational vaccine called as mRNA 1273 to protect against COVID-19. But it will take months to develop this vaccine or to come out in the market. And this vaccine candidate was developed by the researchers at the National Institute of Health and National Institute of Allergy and Infectious Diseases, that is NIAID, and other collaborators at the biological technology company. And this phase 1 NIAID supported trial will look at the safety of the vaccine, which cannot cause the infection because it is made by RNA and not the whole coronavirus, approximately in 45 healthy adults. The first volunteer was injected this past Monday at the Kaiser Permanente Washington Health Research Institute in the Seattle. If all goes well and larger follow-up clinical studies establish the vaccine safety and efficacy, and it will then necessary to scale up production and to make millions of doses, and it is then available in the public. While initiating this trial in record time is reason for hope, it is important to realistic about all the steps that still remain. If the vaccine candidate proves safe and effective, it will likely take at least 12 to 18 months before it would be widely available in the market. So what we have to do in this meantime? In the meantime, social distancing remains the only one of the best weapons what we have to slow the silent spread of this virus and flatten the curve of the COVID-19 pandemic. This will give our healthcare professionals, hospitals and other institutes more valuable time to prepare, protect themselves and aid the many people whose lives may be on the line from this coronavirus. Importantly, saving lives from COVID-19 requires all of us, young, old and in between, to take part. Healthy young people whose risk of dying from coronavirus is not zero but quite low might argue that they shouldn't be constrained by the social distancing. However, the research highlighted here demonstrates that such individuals are often unwitting vector for the dangerous virus that can do great harm and even take the lives of the older and more vulnerable people around them. So think about your grandparents, then skip the big gathering. We are all in this together. So that is the reason it is very, very important for all of us to maintain the social distancing and maintain this to prevent this pandemic at any cost.